Kirk, Dr. Buford from here with Mitch and the rest of the shoulders. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. You've got this clear cannula coming in the front. You're laying on your side, so this is actually the humeral head's the ball-shaped structure at the top half of the screen. This cord on the left is your biceps tendon. We can rotate down, look at the biceps anchor. A little bit of fraying, but it actually looks pretty good. Hold the camera, please. We're going to put in a shaver and just smooth out any rough areas here. And as we get a good look at the anchor, I think that's going to be fine. A little bit of fraying, but again, what you like to do, that's really not an uncommon appearance for the anchor. We'll look towards the back of the shoulder. The posterior capsule looks fine. The insertion into the humeral head looks good. We can look down at the posterior labrum. A little bit loose, but you've had no instability. So again, that's something I think we can kind of politely ignore, as they say. Okay, we're going to look down the front of the shoulder. You do have some tearing in the labrum, or in the cartilage, let's see. A little bit of tearing in the labrum here. I really think, given your clinical exam, and as strong as you are, that our main goal is going to be to take care of the AC joint. Here's the rotator cuff at the top of the screen, and this looks just fine. So the rotator cuff is up above here to the left, and that looks just fine. So we'll keep looking around the shoulder for a little bit. If there's anything else inside the joint, we'll come back up on the video and show you, but I think we're just going to look around and smooth out some more of these areas and then get to work on the bone spur as possible. Okay, Kirk, we're going to go ahead and start a little bit of work on the bone spur. We're up above the rotator cuff tendon. This is the bone at the top of the shoulder called the acromion. And we'll start just by working on the edge. So the burr's coming in from the lateral side of your shoulder. The camera's looking from the back. Now we'll go ahead and change positions and put the camera lateral. So we're going to move the camera to where the shaver is, and we're going to bring the shaver to where the camera is. So we'll go off on the video. Oh, hold on one second. Let's go ahead and put a switching stick in. Okay, so now we can put our next cannula. Just pause. We've got the shaver, or the burr rather, coming in the back. Slowly advance forward. Once you get way to the front here, we'll stop. We'll rotate the camera around like this so we can see the anterior edge of the acromion. Whatever you do to make that drain, it's not really kink under the shoulder maybe, right there. Okay. Sucking, that's why it's okay, so we'll go ahead and take off, see if I stop sucking. Okay, so we're going to go ahead and get this anterior lift. And that's already starting to look and feel better. You can see how that looks a lot clearer now. Okay, hold the camera for a minute. We're going to go ahead and put in our shaver. And we'll take down some of the dorsal tissue and some of this corpoacromial ligament here. I'd like to see the edge of the bone here to make sure we've done a complete decompression. Okay, so what we're going to do next is first take away some of this tissue here. Now this is going to be your clavicle right there. We're going to work on that bone in just a minute. But for now, we're going to hold the camera just a minute. Okay, so give me the burr, please. We'll start our, what we call the Buford procedure from the back here. Just show the camera. Up from the start. And now to finish this, hold the camera please. To finish this, we're going to take out the anterior cannula completely because we're going to reposition it. That's what you said. Blocked in that clear one. There's our outflow cannula coming in now from the back. So there's our outflow. We'll use this to hold down the tissue like that. And then with this anterior cannula, the reason we take it out completely is because we want to realign it right down the joint, just like that. Okay, so that gives us a good shot right down the joint. And now we can use our burr to finish the decompression here. Okay, so here's the burr now. I got the camera. Start like this. Take a little bit off the acromion too. started, what I'd like to do here is rotate the camera so we're looking back, and now we can see down the joint. So here we can see the edge of the clavicle. And then here we can see the edge of the acromion. We can take a couple millimeters off of the acromion just to make sure we've got plenty of space here. And then we're getting a clear shot all the way to the top of the clavicle, so we know we've completed this. Now the way we measure, we know the outer diameter of the burr is about 6 millimeters, and so we've got plenty of space here between the clavicle and the acromion all the way to the back. Make sure there's no bone in here, soft tissue. Okay, so I think we're going to finish up here. The last thing we want to do is have a look at the rotator cuff. So we'll go ahead and back out the burr. And let's have a look down at the rotator cuff. I'm sorry. Using our shavers to remove some of the soft tissue so we can see. Okay, so there is the poster aspect of the rotator cuff. Here's the more anterior aspect. Turn the suction off. Okay, so that's looking pretty good. So the rotator cuff's intact on this side too. So we're going to finish up here and get you back to the recovery room in just a few minutes. Good luck to you now. Bye-bye.